Hello.
Hello, are you one of the doctors here?
I am, yes.
Look here, I want to talk to somebody in this place because Mrs. White, my mum, I don't know if you know anything about her, but I've just been to visit her. And honestly, for my own mother, she now tells me she's got some form of cancer or other. There was some other word, or I can't remember what it was now. But she's got cancer. Now, all right, she's 80. These things happen, but she's had lots of tests within the last 8 months, and nothing has been picked up. And now, on the third visit to hospital, and the third lot of tests, they now tell me, or they now tell her, and she tells me, that she has cancer. Now, is this good enough? Because I don't think it is good enough. Why was this not diagnosed earlier? Because quite honestly, they've done all sorts of fancy tests and cameras and, you know, heaven knows what they've done. And every time they said it was clear, and she's never felt well. She's been put on medication, it hasn't cleared the problem, and she's had to come back again. And where are we now? It's probably may well be too late for anything to be done, when 8 months ago you could have found this out.
Okay. It sounds as though things have been going on for a while. There's a lot that...
8 months! 8 months! When, you know, I mean, well, the problems were for, you know, she was being sick and blood was coming up, and this is why she went to the GP who referred her to tests, and this was all 8 months ago. I mean, how much time have we lost with that?
Okay, so that's something that I want to explore with you in a bit more detail and find out a bit more information about everything that's gone on. I don't think I really got a chance to introduce myself properly. So you know exactly who I am, and so I know exactly who you are. My name's Dr. Alderson. I am one of the doctors on the ward that's looking after your mum. And this is the first time
yes,
that...
not as the case may be. I mean, you know, I'm not impressed at all with MRI. I really am not.
And so this time that your mum's been in is the first time that I've met her. I have spoken to her today, and I found out that she's happy for me to talk to you about all these problems. So that's hopefully what I'm going to be here to do.
Well, I mean, you say problems. I mean, it's bigger than that, isn't it? I mean, let's face it. I mean, there's, well, I would say negligence, to be quite honest. Okay. You know, that's the word I would put on this, because this is not I mean, I've 3 lots of tests, and it's only the 3rd time they discover something like a cancer in an 80-year-old lady. You know, I mean, this is one of the, you know, and she's got blood coming up and things, and this is one of the, as I understand it, one of the symptoms, isn't it, for cancer and everything. Why was this not diagnosed earlier?
Okay, so perhaps what would be helpful is if we went right back to the beginning, and you could perhaps tell me about how things started and what tests they did and what you understand about what was found. And
Well, I mean, I can't remember all the tests at this stage now. It was 8 months ago. Like I said, she was showing she was being sick, blood was coming up and everything. We went to the GP, and they did all sorts of tests and cameras and scans and blood tests and Lord knows what. Oh, everything was fine. Go home on medication. Goes home, she doesn't feel any better, symptoms. Back to the GP. The GP says we'll have perhaps get these tests repeated. This happened. 2nd time round, same sort of tests as I understand. I can't tell you exactly what they were. But the 2nd time round, oh yes, everything's fine, it's all clear. Go home, medication. And she's just been palmed off, quite honestly. What happened to the test results, I do not know. I mean, we understood everything was okay. And then the 3rd time round, she's back here again. And this time only, do they find a problem. And, you know, that is not good enough, quite honestly. You know, really, I mean, somewhere along the line, like I said, somebody's been negligent. They've not read the results properly. They've either lost the results and, you know, I don't know, you know, I mean, it's so frustrating. It's like banging your head against a brick wall, this place.
Okay, well, we do have all those results available to us, and I've been able to go through those. And so perhaps it'd help if I went right back to the beginning and we explained what each of the tests had shown, and so how...
Well, yes, but they haven't shown anything as I understand it. I mean, that's not, you know, it's all right saying going back to the beginning, but the tests haven't shown, you know, we've been told they were clear. And really, at the moment, the crucial thing is, you have definitely established, as I understand it, that she has cancer. So what is it you're going to do about it? And also, I mean, you know, is it too late? And also, what is going to be done about these missed or misdiagnosed or misinterpreted test results that took place earlier, because quite honestly it looks as if, well, you know, I mean, I'm not somebody who, you know, I'm a supporter of the health service, but this is not very satisfactory, and who knows, I mean, you know, who knows, I might need to speak to solicitors or somebody.
Okay, so perhaps if we deal with those two things separately, so we talk about the tests and what all the tests have shown, and then we can talk about the diagnosis and the treatment and some of the options afterwards. Okay.
All right, okay.
Might be a bit easier that way.
Yeah, all right.
So the original test that your mum had done was because she'd been having some pain and she'd also been vomiting some blood. Is that right?
That's right, that's right.
Okay. And I have the results of that test here in the medical notes. And that was an endoscopy test or a camera test, wasn't
that's
it?
right,
Yeah.
she had that.
And that actually had a really good look at the gullet, so the esophagus and the stomach. And it wasn't completely normal, but all that did show was that there was some sort of ulcers, if you like, in the esophagus and also in the stomach.
But they're not very serious, are they, ulcers and things? No, that's all understood, yeah.
And you know, they can happen, and it's not an uncommon problem. They did take some biopsies at that time, so some small samples of tissues to look at under the microscope and see if there was any abnormality, like, you know, like a cancer, or whether this was just an ulcer. And at that time, those biopsy tests were okay, so there was no cancer seen on those.
But at that time, I mean, this is only 8 months ago, that's not a big time scale, is it? I mean, surely there must have been some early signs on the tests, that, you know, because we've got to the stage we are now, which, as I understand it, or my mum understands it, it's in a fairly serious condition, the cancer. Well, I mean, that's very rapid, isn't it? I mean, surely, I mean, there must have been signs 8 months ago.
On those biopsies that they took, there wasn't any evidence of cancer on those samples. Obviously, they don't sample the whole of the gullet, and they can't sample every single ulcer.
So, you're saying that it might have already been there in an area that they didn't actually look at?
If they saw anything very abnormal, they would normally take a biopsy, so a sample of that area, and sample some other areas for comparison, if you like.
I see.
And they have taken some pictures of the ulcers, and they've shown where they've taken the biopsies. But on those biopsy samples, there was no cancer. So in the samples they took, there wasn't any cancer present. That's been ignored.
Okay then, okay. Accepting what you say, and we've come to the second lot of tests. When she didn't improve, something was still upsetting her, which presumably was the cancer. And then she goes to the GP, who says it would like these tests repeating, and as I understand, basically she had the same set of tests again. Is that correct?
No, she actually had slightly different tests that second time. So first time she'd had the camera test, okay, and she'd been started on some treatment to try and reduce the stomach acid, to try and help heal those.
Wasn't working.
But as you say, things hadn't got better, so that's when the GP then decided to do some more investigations to try and get to the bottom of the problem. And the two tests that she had on that occasion were a chest X-ray, okay,
right.
So an X-ray of the chest, to look to see if there was any problem like an infection in the lung or anything else that might explain why she was getting worse.
Right.
And that was clear, that didn't show anything. And the doctor looked at that, and that was also reported by one of the specialist X-ray doctors, and they didn't find anything abnormal on that.
Okay.
The other test that she had along with that was something called an ultrasound scan, so a jelly scan of the stomach, so looking at all the organs in the tummy. And again, that didn't find anything abnormal.
But were those appropriate tests, given that, you know, of the symptoms she'd had? I mean, you said they'd been looking for cancer earlier, and the problem she had was still continuing without improvement. Didn't that suggest to somebody that there was still a cancer there that maybe you'd missed the first time? Or, you know, I mean, doing chest X-rays somehow, to me, don't sound all that appropriate tests, actually.
It's, you know, it can be very difficult to to decide on the best test. But I think the problems that your mum was having at that stage was that she was losing a lot of weight and that she wasn't eating very well, and she was still having some sickness.
But isn't weight loss one of the cancer
and so one would expect
symptoms?
That if there was, say, something like a cancer in the lung or a cancer somewhere in the tummy, that those are reasonable screening tests to use to try and see those. And I think if there'd been something like a big lung cancer, you would expect to see that on a chest X-ray.
Right. Okay.
So I think that it sounds to me as though it was reasonable for the GP to do that as the next stage to try and get to the bottom of it. But obviously that didn't quite get to the bottom of it, did it?
No. So this third time, where we discovered it, well, what was the test you did on that occasion? Did you do the camera test again?
No, so this time we did something called a CT scan, so a special sort of fancy X-ray test, a body scan.
Yeah.
And that was because the first 3 tests hadn't got to the bottom of the problem. We needed a much more detailed sort of scan, if you like, to try and pick up.
Well, would it not have been more appropriate to do this originally 8 months back in the first instance?
Well,
if it's a more detailed one, as you say.
When your mum presented 8 months back, her main problem was some vomiting some blood, wasn't it?
Yes.
And so, at that stage we were worried, I guess we were worried about things like ulcers, and we did see some ulcers.
Yeah.
And when we do a camera test, if there's something like a bleeding ulcer, sometimes you can treat it at the same time.
Okay.
And so I think at that point, that sounds to me as though that was a pretty good test to do.
Yeah, okay, there's a lot of explanations here which I'll need to think about, but the problem we've got now is obviously this cancer.
Yeah.
I mean, how serious is it? She seems to think it is pretty serious.
Yeah.
Is that right?
Yeah, she's right there. She has got a cancer in the esophagus or in the gullet.
And what is going to happen? How are you going to treat that?
Okay, so what we'll be doing is asking the oncology doctors or the cancer specialists to come and have a look at things.
Yeah.
And what they'll do is they'll review the CT scan and all the other investigations we have, and also review your mum and decide on the best sort of treatment to do, really. So whether there's, what they feel would be the best for her, and so whether that's something like some chemotherapy treatment or something else, I'm not sure what they'll say, but they're
you think
the
it should be
specialists.
treatable though?
Well, they're the specialists and they're the people who are going to be able to advise us.
But in your view, you think it's probably sounds treatable?
I'm not a cancer specialist, and I wouldn't want to sort of give you information that then turned out to be incorrect.
Right.
We need to wait for them to come and see, and I would hope that they'll come later on today. And so
I should hope so, yes.
To come and have a look at your mum and have a look at all the information, and then they'll decide as sort of a team as the best way to move forward with things. So that's going to decide as to whether or not we can treat the problem, the best treatment.
But given her age and the fact she's been not well and losing weight and things, chemotherapy and cancer treatments is going to knock her for 6, isn't it?
Well, that's why it needs to be a very carefully considered decision by the specialist. Decide whether or not that would be the best thing, or whether it wouldn't, and whether it would cause more harm than good. And that's why, we need.
You're saying you might not treat it at all, or they might decide not to treat at all?
Well, that's why we need their input, is to give us, to help us with that decision. And, there's something that they're very experienced in. They're specialists in this area.
Yeah.
And so allowing them to sort of guide us is really the best thing to do. I think one thing that we do need to do, and one thing that I think could be helpful for yourself and for your mum, is to get our Macmillan team involved here.
Right, okay. Well, we'll have to see there. As I say, I'm still not fully happy, convinced about the treatment, because as I say, you've given me, like you said, you haven't come across this, but, dealt with it before. People have done tests, so, I will look, perhaps have to look into this. But for the moment, as I say, the key thing is to get this cancer sorted off. Okay, all right. Well, thanks for talking to me anyhow.
It's my pleasure.
Okay.
Was there any more questions that you had at the moment?
Not now, no.
Okay. No. Obviously, we'll be discussing things a lot over the coming days, but if there's anything you think about before we next meet, then,
Yeah, okay.
All
Right, okay.
Okay.
Thank you.
Thank you.
Okay, thanks very much, Helen. It was obviously a challenging scenario. Can you just recap for me what you went through there with the patient?
So the patient's son obviously already knew the diagnosis that she had an esophageal malignancy and was very sort of angry and frustrated about the fact that it had taken so long to diagnose that. So I explored with him a bit about the tests that she'd had done and made sure that he understood the results of those tests, so that this was the first time the cancer had actually been diagnosed and that it had not seemingly been missed on any of those investigations. And then after I'd done that, and so he'd understood about the problem in a bit more detail, I then explained to him about how the treatment and a further management would be conducted, so principally by involving the Macmillan and the oncology team.
Okay, thank you very much. He was clearly very angry and upset with the care that had been offered to that point. When a patient or a relative is in that sort of position, is there anything that you've got to be careful not to do?
I think you have to be careful that you don't apportion blame to previous teams that have investigated her, that you're open and honest about the results of the investigations, and that you make sure that you explain those clearly so that they understand. A cancer hadn't been demonstrated on the previous investigations, and so I explained that, and I explained the rationale for the investigation she'd had, and he understood that had been actually quite a reasonable sort of strategy to investigate someone. So I think you have to be careful that you don't blame previous teams, particularly when it's not justified to do so, but that at the same time that you're open and honest about things.
Okay, thank you. Scenarios with an angry patient or relative can be very challenging. You've got a lot to get through in the scenario. However, if you try and cut into the patient or the relative and don't let them express their concerns, then you'll never give them the opportunity to calm down. The important thing here is to allow them to set the agenda, acknowledge what they want to discuss, and set a time frame in which you'll discuss it. By letting them express their feelings first, you've got a better chance of them calming down and you then being able to direct the conversation where you need to.